So a common question people ask is, does the robot do the operation or do you do the operation, doctor? So no, the surgeons do the operation. The robot is just an instrument. And the instrument is used just to facilitate the smallest of incisions and essentially next to zero trauma. And so one surgeon sits at the console, and that surgeon is manipulating the actual robotic instruments, the multiple arms, all simultaneously. And the surgeon at the bedside helps with direct care as needed and robotic instrument exchanges and things of that nature. That team approach is essential for the expediency, the speed, and the elegance of how the robot operations work. How do we do robotic surgery? So that's done, instead of through the front, we go through the fourth rib space on the side, basically under the armpit to the right. It's all on the right side. Now, people often ask, well, why are you on the right side when the heart's on the left side? Well, the reason for that is that provides direct access to all of the valves of the heart and the chambers of the heart that we commonly perform robotic surgery on. We access it from the right side through a small incision about anywhere from 3 centimeters to 4 centimeters. And we don't break any ribs. We just go through what's called the oblique muscle and the skin, not the pectoralis muscle, which is the large muscle here, and not the latissimus dorsi muscle, which is the muscle of the back that I'm sure people have recognized. Because it's really minimally traumatic, we put a few little ports also about the size of one's pinky nail, 3 to 4 on the chest around the working incision to pass instruments, the robotic arms, into the chest. Of course, everybody's asleep. We make a small little nick in the groin and a small little nick in the neck where we place tubes to take over the work of the heart and lungs. Then we go inside the heart at the time of the heart operation using the robotic technology after we put the heart to sleep, like we do in every other heart operation. And then using the high fidelity visual optics of the robotic camera and the telemanipulation of the wrist actions of the robot, we're able to achieve really excellent outcomes for patients for valvular reconstruction or repair, valvular replacement when needed, and then surgical treatment of atrial fibrillation. In our center, we've helped pioneer a few different things, not only robotic mitral valve repair, which has been the most common operation that we do, but also aortic valve repair or replacement, which is something we've developed here, but also surgical treatment of atrial fibrillation. All of those types of treatments, and sometimes in combination, can actually be done robotically. One thing to note, to remember, that when you come for robotic surgery, we give a small little injection on the back, our anesthesiologists do for those that are candidates, to just numb the nerves a little bit to minimize pain almost completely for many patients. We put a little catheter in the left arm and a little catheter in the neck. That'll be done after one's asleep. So after surgery, the recovery is quite quick. In fact, the vast majority of patients with robotic surgery will come off the ventilator in the operating room. Just ask your anesthesiologist if you're a candidate for that approach, and that helps expedite recovery. In fact, many patients are out talking and almost immediately can meet with their family members and loved ones.